We're kicking off our Breast Cancer Awareness Month series, Thriving in Pink, and we are surrounded by the faces of some incredible breast cancer thrivers. Thanks to the Breast Cancer Organization, Susan G. Komen, for these images of strength. And this morning, we're looking at the latest advancements in the fight against the disease. Joining us are two specialists, Dr. Abena Brewster, an oncologist at MD Anderson Cancer Center, and Dr. Ami Shah, oncologist at Lurie Cancer Center at Northwestern Medicine. I enjoyed talking with you during the commercial break, and just so grateful for what is going on. And I want to start with you, Dr. Brewster, because studies show during the pandemic that nearly 47% of people, they did not have their breast cancer screenings, and that has led to later diagnoses. So what is your message for them this morning?
So Robin, you're absolutely right. And I have patients in my practice who for different reasons didn't get a mammogram during the pandemic and now are being treated for later stage of disease. And so I cannot emphasize enough the importance of women getting back in and getting their regular screening mammograms. We know that early detection with a mammogram improves survival. At MD Anderson, we recommend that women start screening at age 40 and have a mammogram once a year. And if women are at high risk, that they have a mammogram and an MRI alternating every 6 months. And most women have no idea if they're at average or high risk of developing breast cancer. So I encourage women to have that discussion with their physician. The physician will review their risk factors, review their family history. They may even order genetic testing because there's so many more genes that have been identified that can contribute to breast cancer risk. So I would encourage women, the bottom line is it's time to get back to regular screening mammograms and having that discussion with your physician to determine what is your risk of developing breast cancer, what type of screening you should get, and the timing of the screening.
Exactly. And I have to say, men also with breast cancer. We hear this every time we do a segment like this. Okay, Dr. Shah, treatments. I mean, there have been some advancements as well, right?
Yes, there's a lot to be excited about, to be hopeful about. For triple-negative breast cancer, immune therapy has been an important development. This is a type of medication that activates our own immune system to better recognize cancer cells. And in doing so, we do better jobs of treating the cancer. For those with stage 2 and 3 triple-negative breast cancer, adding immune therapy to chemotherapy creates better responses, results in fewer recurrences, and is going to cure more patients. And it also benefits those in a subgroup of triple-negative breast cancer that have metastatic disease.
Oh.
We've also seen the development of a category of drugs called antibody-drug conjugates. And these drugs, they take chemotherapy and they connect it to an antibody. That antibody serves as its guide through the body, trying to bring that chemotherapy in higher levels to the cancer and less to the rest of the body, hopefully sparing some of the undesired side effects and getting better responses with the tumor. And so we're only scratching the surface of the potential of those medications.
Only scratching the surface. And you brought up metastatic, and I do want to talk about that in just a moment. But first of all, Dr. Brewster, we have seen that different ethnic and racial groups, it affects differently. So can you just talk about the differences?
Absolutely. So Black women, and I would say particularly younger Black women, have about a 2 to 3-fold higher risk of developing triple-negative breast cancers. And triple-negative breast cancers are an aggressive type of breast cancer. So we want to catch it early in order to give women the best chances of being cured. And so I would recommend that Black women have a mammogram every year. And if they feel a lump in their breast, to bring it to the attention to their physician sooner rather than later to get it checked out. We don't fully understand why Black women have this higher risk of developing triple-negative breast cancers, but what we do know is that when Black women have equal access to early detection and equal access to some of the state-of-the-art treatments that Dr. Shaw mentioned, they have a similar prognosis from triple-negative breast cancer as white women.
Oh my goodness, I remember when I was diagnosed with triple-negative and had to go through the radiation and chemotherapy and the surgery, but to think of the advancements from then to now. But there's still some communities, Dr. Shaw, that screening just is not in their mindset to do. Why do you think that is?
Yeah, I think there's a lot of things that are barriers or misconceptions that lead to people not getting screening. I think one thing we hear all too often is, I don't have a family history, my mother never had a mammogram, I live a healthy life, it won't affect me. And unfortunately, that's just not true. 1 in 8 women will be diagnosed with invasive breast cancer in their lifetime. And so it's important that everybody, including those with average risk, get regular screening mammograms.
And can we talk about metastatic breast cancer? Because so often, it's a group that is overlooked, and it's not one size fits all. There are different types of breast cancer, but metastatic, it is so different from the others.
It's true. Metastatic breast cancer is when the cancer has traveled outside of the breast and the immediate lymph nodes to other parts of the body. And it is a type of breast cancer where, for the majority of patients, we don't have cures, but we absolutely have treatments, and those treatments are advancing very quickly. As we talked about some of the new exciting medications in that area, and there's much more in the pipeline, and that's where people's research dollars and patients' willingness to participate in clinical trials has really made some important strides. And we're looking at studying the tumor or studying DNA, fragments of DNA in your bloodstream that could help guide us to match that right treatment. And so those research, that research will hopefully translate into better and better outcomes, because we see patients every day with all stages with metastatic breast cancer who are thriving.
I saw a woman outside with Amy in the group, and she was like defiant. She's like, I'm going to keep fighting. I'm going to keep fighting.
Yeah, absolutely.
But what are some other ways that can help prevent breast cancer?
Well, we all know that saying, an ounce of prevention is worth a pound of cure. And so there's been great news in prevention. Over the past decade, we've been using what we call preventive therapy, which are essentially estrogen blocking pills that women take for about 5 years that can reduce their risk of developing a breast cancer by about half. And these pills are usually recommended for women who are at high risk of developing breast cancer. And that means women who have a strong family history of breast cancer, or who may have a type of benign breast lesion that puts them at increased risk. The majority of women who take these pills do very well, but there are some side effects, particularly for the pill called tamoxifen. And so having a discussion with your physician and finding out whether or not you're a candidate for preventive therapy, I would certainly recommend for women who are at high risk.
Dr. Brewster, Dr. Shaw, wonderful to meet you both. Thank you for your tireless efforts and the work that you do. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.